all and have this really great conversation. My name is Austin Lee, and I use they and them pronouns. I'm going to be the moderator for tonight, and we have 4 wonderful panelists joining us. So this conversation is being brought to you by the Rainbow Support Clark County Coalition, which is a group of community advocates here in Southwest Washington. And our goal is to increase access to resources for people living in Southwest Washington, in particular LGBTQ plus folks, and to be advocates for the needs of our community. This conversation is the first in what we hope will be many conversations about resources and how to make sure that the needs of our communities get met. We've selected tonight mental health resources because that was by far the biggest resource that was asked for participants in the online survey that we've been doing here in Clark County. If you haven't had a chance yet to participate in that survey and you'd like to, you can find links to that on our Facebook page, which is Rainbow Support Clark County. We'd love to get your feedback and know what other types of resources and topics are important to you. So, before we get started with our conversation tonight, I'd like to welcome Karissa, who is a Cowlitz Tribal member and a member of the Cowlitz Tribal Council, to offer a land acknowledgement.
All right, Klahowya, everyone. And that's, okay, so that's the Chinook jargon word for hello. And so when I start off these land acknowledgements, I like to say Klahowya, and then I explain it a little bit awkwardly, and then I encourage the crowd to say Klahowya back. So if we could all unmute for a moment. Klahowya.
Klahowya.
Nice.
Klahowya.
Excellent work, everyone. And I like to think of this as not necessarily something that happens before the conversation happens, but rather as kind of an entry into the conversation, because you know, we've all gathered together virtually, but still gathered together as we can during this challenging time of pandemic, on or near a piece of land that has traditionally been a part of the Cowlitz homeland since time immemorial. And back before the invaders came, we didn't really have county boundaries or state boundaries. We did have our respective homelands, but it was more of a watercolor boundary situation. And you had families scattered all across the Northwest. So the rivers were kind of highways, and we had this robust network of villages across the Northwest. And the system of kinship was maybe not so much like you would see in the Western culture that is currently ascendant in this part of the world. And so the Cowlitz people, we fought a long battle for recognition. I see a lot of parallels between the Cowlitz story and the story of the LGBTQ community, because for a long time we were fighting for respect and for our rights and to be recognized for who we are and our identities. And we had people telling us that we weren't real, we didn't exist, we were wrong, but we persisted. And a lot of the times the fight was underground, a lot of the times it was underfunded, but we were eventually victorious, and it's a great space to be in. And I think I see a lot of parallels between our two communities. And also, while the challenges that we're facing right now are different than the ones that we faced when the invaders first arrived, there's definitely some more parallels between the pandemic and those times. You know, it's hard to feel cut off from your community and family and to have your movement restricted. It's hard to keep a positive and healthy outlook when you've got the specter of disease hanging over the land. And I think, just to lead into the rest of our conversation, the point that I want to end us on is to reflect on how those who don't support, say, the Indigenous community or the LGBTQ plus community or LGBTQ plus Native folks, we like to call ourselves Two-Spirit, those who would like to see us not succeed generally do best when we are at odds with each other and not taking good care of ourselves. So taking the time to gather together and talk about self-care and mental health during a time like this, I think, is a fantastic step and an important step in making sure that everyone stays in the fight and stays healthy. So thank you so much for having me here. I do need to step out a little bit early to go get my little kiddo, but I'm grateful to be here, and I'll hang in as long as I can. So I raise my hands up to you. Thank you.
Thank you, Karissa. I really appreciate that. And I would also like to lift up the role of Cowlitz and other tribal members in making this event happen today. Some of the core members in the conversation today and doing all the planning work for this are tribal members. So without their work, we couldn't be here. So thank you. As I mentioned, we have 4 amazing panelists that we get to hear from tonight, and we do invite you to share questions that you have for panelists. We do have a list of prepared questions, but we want to hear what's important to you too. So you'll notice on your screen there's a Q&A feature, and you can enter your questions there. When you type them in, you have the option of doing them anonymously. Either way you enter them, your name won't appear on the screen, and I will make sure that I ask them anonymously, unless you specifically say that you'd like us to say your name. And when you submit those, they'll pop up in a little screen for me, and I will find breaks in our conversation where I can ask our panelists those questions. We also have a bit of time in the middle where we're going to take any questions that we haven't been able to address from the participants. So the chat feature is disabled for participants right now. So if you have any tech issues or something comes up that you need to communicate, you can just do that through the Q&A feature and we'll see it there. Let's see. So as I mentioned, if you just came in, we are recording this discussion, but your names and your photos won't be appearing on the screen, and everything's going to be done anonymously through the Q&A box. We will end our conversation with our panelists at 7 p.m. tonight, and we'll end the recording at that point, and then we will open up the space for additional questions or sharing from participants who can then come off mute, show us your video if you'd like, and just be part of a community discussion. So, having shared all that info with y'all, I would love to jump in with our wonderful guests. I'd like to invite our panelists to introduce themselves, including their name, their pronouns, and then what types of either mental health services they provide, what specialties they have, or if they're part of a health system, what their health system offers in terms of mental health support. So let's try to go in alphabetical order, which is Mackenzie, Maddie, Megan, and then we'll end with Summer.
Thanks, Austin. Can you hear me okay? Cool. So my name is Mackenzie Dunham. I use she or they pronouns. And I work at, and I've co-founded Wild Heart Society, which is a group practice in Vancouver that serves a wide variety of different people, but my specialty is transgender kids, and I don't so much focus on adults, but really transgender kids is really my focus. But I do have clients that range in age from age 4 all the way up to age 65. So, but I'm best known for my kiddo work.
Hi, can you all hear me? All right. My name is Maddie Wegener. My pronouns are they and them. I'm a non-binary trans person with lived experience of mental illness, addiction, and eating disorders. I do peer support through Legacy's Gender and Sexual Health Program for trans, intersex, and gender diverse people who are either in or have recently experienced a mental health crisis. So mostly what that means is just like being in relationship with people and helping them solve the day-to-day problems until they get to a point where they feel like they don't want or need that support anymore. Check.
You can hear me okay?
Mm-hmm.
Cool. Hi, my name is Megan. I am a mental health therapist at the Cowlitz Indian Tribe. I work specifically, most of my caseload is co-occurring folks, so people who struggle with mental health and addiction. I primarily in the mental health department, but we are currently working on creating a specific co-occurring program, which is really exciting. So somebody doesn't have to be involved in 2 separate programs, but they're involved in one co-occurring program, which is super cool. So yeah, that's what I do.
Hi, my name is Summer Brown. I use she, her pronouns. I own a group practice in downtown Vancouver called Therapeutic Change, PLLC. My primary focus is supporting folks with marginalized identities. So Black, Indigenous, people of color, anyone underneath the queer umbrella, folks in bigger bodies, folks navigating disability in some way. The majority of folks that I work with right now, I think, similar to Mackenzie, I think the youngest I'm working with right now is 8, and then the eldest is 60 something. I also do, I work with couples, families, individuals. I supervise a couple of interns from Lewis and Clark. So we do our best we take Medicaid insurance, so we can do our best to serve as many folks as need access. And we try to run groups pretty regularly. It's really difficult to do right now, especially with everything being online. I am queer, fat, Black, and pretty awesome as far as I think, but yeah.
Indeed, you are awesome, Summer, as are all of our panelists. So I would love to jump in with our first question. What advice do y'all have for LGBTQ plus folks who want to find a mental health provider that is truly affirming and truly culturally competent? And can you think of any resources or lists where folks can find or access an affirming provider? So is there someone who'd like to start us off?
Say Legacy's like the gender and sexual health program. Sorry, I usually end up calling it the trans health program. So just kind of offhand, so I have been doubling over it a little bit in my head. But we do have a pretty extensive database of like trans competent and LGBTQ competent providers. It's largely centered around Portland, but we do serve patients that come from Washington very frequently too. So we do have some resources for Clark County. It's 503-413-5600, and the patient navigator, Cody, is also trans and pretty awesome.
Mackenzie, I saw that you had your hand raised.
Yeah, I was just trying to figure out how to unmute myself. This is a nice, fun lesson in humility today. So I will add, so yeah, Maddie I would recommend that people call around to different known organizations that specialize and focus on this work. So like calling Legacy, calling OHSU, calling the Kaiser Gender Pathways Clinic. Most of those organizations have a list of providers that they know and trust to provide competent and affirming care. So I would start there. Also, CAP has a list, and I know that there's, for kids, there's Triple Point keeps a list for Clark County, and the Triple Point is closely connected to the Queer Youth Resource Center, and they have lists as well. So that's where I would start. And then once you get referred to somebody, or if you're just having to like go down the list of who your insurance provider or your insurance gives you, because that sometimes is where you start, I would ask questions about what their training is, what their experience is. I mean, interview the clinician that you're thinking of working with, because sometimes people say like, oh yeah, I love this population, and they've got like 2 clients ever that they've worked with. And so they really don't have a lot of background or training or just a deeper understanding of what issues someone from the LGBTQ plus community is going to be facing. And so I know that a lot of clients that I have worked with have gone to different therapists and then found themselves being the educator. And that is not what an affirming therapist is. An affirming therapist should know their stuff and know how to engage with you as a client in a way that is not to their benefit, but to yours.
I want to add that most of the responses that I'll probably share today come from also the intersection of being a Black person. So there is a list that that's going around of African-American therapists. And so sometimes people will access that list. You can do a search on like some therapist marketing websites, and specifically Mark, that you need somebody who's affirming. I would agree with Mackenzie though. Sometimes people just check that box because it's easy for them to do. One of the other things I would say is like ask your friends. So if you have somebody in your world who is seeing a therapist and they feel like they're getting pretty good affirming care, ask them. And then worst case scenario, that therapist probably knows somebody. If they can't help you out, they probably know somebody. It's pretty common in the community to like, you find the affirming medical provider and then everybody sees that person. You find the affirming therapist and everybody sees that person. I would say that the biggest thing that I will always say to people, similar to what Mackenzie said, is like, it's not your job to teach your therapist stuff. I want you to feel empowered and being like, you actually don't know what you're talking about. I need a different therapist. It should never be your responsibility to make the space safe for yourself. That's their entire job, is to make you feel safe and make you feel heard and make you feel seen. And the duty of a therapist is, if you don't know something, go find out. Don't put it on your client to educate you. Go take a training, go get a book, read something, attend consultation, all that kind of stuff. I think also what happens most of the time when people come into therapy is they don't realize necessarily what it is that they want support with. And so you'll come in kind of initially with like, oh, I just need to work through this interpersonal thing that I'm having. And then suddenly you're realizing there's all this other stuff that's coming up that's maybe connected and you didn't realize why. So my suggestion would be, before you meet with somebody, maybe make a list of the things that are important to you about a therapist, about the kind of relationship you want with a therapist, some of the things you'll want to talk about. And then when you go to interview that therapist, you can be like, hey, so this is a thing. And they can be like, I don't know anything about that. And you go, okay, well, deuces then. So just be prepared to like, it's okay to fire a therapist who's not a good fit for you. And it's definitely okay to push back when somebody has the expectation that you're going to teach them everything.
I would like to follow up on that and add, for my Native identified folks out there, the Northwest Portland Area Indian Health Board, they have a website, they have a tab specifically for Two-Spirit LGBT, and there is a tab for providers for information. There's a tab for allies for information, and there's a tab for folks who are identified as part of that community. And part of that resource is that you can find a provider that is affirming for you, and that's part of that website.
Great, thank you. A lot of these resources we're going to be putting up on our Facebook page after this event. And so we'll make sure to check in with the panelists and make sure that all that stuff gets put onto our resource list so folks can access it later. Oh, bye, Karissa. Thank you for joining us. I just love this crew. Y'all have such good ideas, and we could just talk for hours and hours. So one thing I'm curious about is if you or folks within your practice offer virtual visits, and if so, might be a really new thing for folks. So could you speak to what folks might look to expect from a virtual visit?
So as far as virtual visits, two things. One, a lot of insurance companies are covering virtual visits right now because of quarantine. But I don't know about y'all, but I feel like every insurance company has a different date they've picked for when they're not going to cover virtual visits anymore. And in the past, before all this, a lot of insurance companies weren't covering virtual visits overall. So if you do engage in therapy like through telehealth right now, I would check your insurance company and talk to your therapist about concerns you have about how long it'll be covered and how long they'll be offering it. Personally, I use an electronic health record that does everything paperless anyway. So most, in terms of virtual visits, the initial appointment is usually you send out the paperwork, the client completes it, you bring it back, you go over it together. And so you schedule those appointments. I log in, client logs in, we have our sessions just regularly as scheduled, except they're online versus face-to-face. I think that's pretty much as far as I'm discovering is the biggest thing, is like not sharing space with people, which is my favorite part of doing therapy. So I'll be honest, I'm kind of struggling right now. So it might look a little different, but the process at its core is probably still the same.
I think that Summer and I actually use the same system, but I will add to that that one of the things that comes with virtual visits is that doesn't necessarily show up in an in-person session is technical difficulties, right? So if your internet speed isn't fast or strong, that affects the visit. And so if you're doing your session in your house and you've got somebody who's in the next room, that creates sometimes uncomfortable environment. And so I actually have clients who will do visits in their cars right now to get privacy, because that seems to be a bit of an issue. I've also known like so the program that I use for my EHR requires, if you're going to use a device other than a computer, that you would have to download an app. And so that's something also that comes up. Just like Zoom kind of requires you to download an app if you're using it on a device. Zoom does have a HIPAA compliant, meaning super confidential, nobody can break in, level of service that providers can pay for. I don't know that all providers are paying for that, but I'm just saying that there's been a lot of conversation, especially when schools first started using it, about Zoom bombing, and like people would just drop in. And the way that clinicians are supposed to use Zoom, it should be password protected, locked down, and you should not have the risk of somebody just being able to type in some random numbers and ending up in your therapy session. And that is the case also for the links that would get sent out for mine and Summer's electronic health record system. They're long and they're complex, and they're unique every single time. So it's never the same number that gets sent out to every single person. Confidentiality is still really important, even though we're doing it via telehealth. And yes, I do provide telehealth visits. Right now, my entire practice, my entire practice is doing telehealth. And I think that I know that it's not, I'm in the same boat as Summer. It's exhausting. It's way harder to sit in front of a computer screen than it is to sit with people. So that's actually caused for most of my clinicians on my team to cut back because of our own need for self-care. But I'll add to that while Summer is correct about the insurance information, but we really don't know how long insurance companies are going to continue to cover telehealth. I know that each clinician that I know, and the clinicians on my team in particular, are planning to remain in telehealth until we are not required to wear masks in front of other people, because doing a session like this is actually way harder than doing one like this. So.
I'm curious, Megan or Maddie, if you wanted to add anything. In particular, I'm wondering, Maddie, if you have any thoughts from your peer support background about how folks can engage with virtual visits.
I'm mostly doing phone visits with people. Like I'm not doing anything through Zoom, and I'm actually trying to do a fair amount of stuff in person, because a lot of the people that I am working with are also experiencing houselessness, which is a huge barrier to communication. So I try to actually be physically available to people, like by going for walks in parks, that kind of thing. And the other part of it is, I think, isolation, social isolation, and like feeling very unsafe around other people is like such a huge and constant stressor for trans people in particular, but I think for a lot of LGBTQ people. And COVID has compounded that in a way that has been really intense, and like watching everybody struggling under that has been pretty brutal. And so I have also been trying to do physical visits for that reason, just because of how lonely this is. So I don't know if that's helpful.
I want to echo the phone too, actually. The majority of my clients are uncomfortable with video visits. And so I think probably a small handful of my clients have been video sessions. The majority have been over the phone. So what I'll just say to that then is, your providers are flexible. That seems to be the name of the game right now, is how flexible can we all be? And we're in the same boat that, we're all in this quarantine boat together, and we're all figuring it out. So I'm happy to do sessions over video. I'm happy to do them over phone, whatever makes people comfortable. I try to switch up my background. Right now we're plants and paintings. Before we were blue wall, to make the backgrounds more interesting, other than just the pretend the green screen, right? So yeah, it's interesting. We're figuring it out. I've never done a video session until this, and I don't know if I'm gonna enjoy that after quarantine is over or not, but
Yeah, that's really wonderful advice. And I think what it shows us too is that you want a therapist, you want a provider who is really centered on you. So someone who will do a phone visit if that's more comfortable with you, someone who's willing to maybe meet you in a park and go on a walk if that's something that they're comfortable with too. Hopefully you can find a provider that's going to help meet those needs that you have and work with you in that way. So I want to remind folks who are participants that you can use our Q&A feature if you'd like to ask any questions of our panelists. And I'm going to send out a chat with the email address, the Gmail address for the Rainbow Support Clark County group, in case you want to email us any questions you have, any thoughts, or any resources you do want to share too. One thing I am curious about from our participants tonight is what sort of barriers to finding or accessing mental health services have you heard about or have you experienced yourself? And we'll see if our panelists can help address any of those. So if you get a chance, go into our Q&A and ask some questions.
I also wanted to say, if you see me looking around, I've got a little ADHD and I have to doodle to stay focused. So I'm totally with y'all.
Thanks, Summer. So while we wait for folks to populate any questions they might have, I'm curious from our panelists, if you can think of any good resources for folks who are looking to access care, but who aren't enrolled in insurance, and in particular for folks who are not able to pay out of pocket. So any sliding scale, free, low cost services you can think of.
So the interns at Wild Heart Society see folks who are uninsured or underinsured, or for whatever reason can't use their insurance. There's a lot of concern sometimes around EOBs going home or going to a parent, or getting outed in that way. And so so I have 2 interns right now, and I'll have a 3rd one joining me in September and a 4th one that will join in January. So the interns all provide free services for LGBTQ folks. You have to be LGBTQ identified in order to get them for free. So that's a sort of a thing. You have to let us know. So that's a little bit uncomfortable. I'm trying to figure out a way to make it so that people don't have to necessarily out themselves from the first day in order to let us know that they would be eligible for free services. But other than that, if you are someone who qualifies for Medicaid, that's another avenue for people to be able to get some level of care and some level of services. Wait times are often long, and your ability to pick your provider is often harder. But I know that Summer's group takes Medicaid. I've been trying to take Medicaid for a year, and I'm really angry about it.
Yeah.
So we've been trying to get our contract up and running for a year now. So that's really frustrating as a provider to know that that's something that we really feel strongly about is access. So there's also, if you're looking for letter writing services, I know that there is, I will find it, Austin, because I can't remember what it is. Maddie, you might know, but there's a list of providers that will write letters for free. And I write letters for free. It doesn't matter. I mean, if you're looking for a letter, it doesn't matter how old you are. You don't have to be a kiddo. I'll write letters for free. And I often ask if you have the ability to pay for them, that you make a donation to a list of, I'll give you a list of organizations that I think could benefit from a donation as opposed to paying me for the letter. So.
One little known resource that folks might be able to access is if they're working at a place that has an EAP program. EAP programs can cover a couple of sessions with a therapist at no charge out of pocket for you. My interns do a sliding scale of $25 per session, or they take Medicaid. I know Taraji P. Henson has a fund where she was providing free therapy for Black folks. And then I also know somebody else was providing therapy for people of color. There's a whole bunch of resources. And if you find a therapist that you really like, you can ask them if they offer sliding scale or if they have any pro bono slots. That's an option as well. Most of us try to keep a couple slots available for folks who can't afford to pay or who, just can't. It takes a while sometimes for Medicaid to go through. And so in that limbo time, that's an option as well. But the EAP program, you would call whatever EAP company your business, your workplace uses, and you would say that you had a presenting problem that you needed help with. And then they would refer you to an EAP therapist. And then, for example, you could call again when those sessions are over and say, I have a different thing I need to talk about. And then you get more sessions. I mean, that's just like technically how it works. So.
I will say to you, oh, you want to go? No.
It's okay, go ahead.
A lot of community mental health agencies have folks whose job it is to help you get on insurance if that's something that you're looking for. At the Cowlitz Tribe, we have someone that's part of her job to help folks get on insurance. As a tribe, technically, it's in that limbo. It's not really community mental health, it's tribal mental health, but sort of. Anyway, so that's something too. It's a lot of community mental health agencies. They have someone whose job it is to help with that. And then Cowlitz Tribe, we do accept Medicaid, and then for folks who, there are times when someone can't afford a session and they don't have insurance and they're trying to get insurance or for whatever reason, and there are times when we do services and there's just no fee, and that's totally fine too. We've done that. I should have said this in the beginning, but at the tribe, we see folks who are Native identified only. In addition, if you live in a home with someone who's Native identified. I should have said that in the beginning, but I see about my audio. It's probably my headphones. I'll take them out.
Maddie, did you want to chime in on this question?
I was going to say a couple of people that I found really helpful to read are Pete Walker about complex trauma, Sam Dillon Finch, who writes about trauma and mental illness and trans people like beautifully in a way that has helped me an enormous amount, and Adrienne Marie Brown, particularly for Black women and femmes, is also amazing. And in that case, definitely buy her book, Pleasure Activism. Pete Walker and Sam Dillon Finch both have afford to buy the book. And I I think I'm technically free. If you have been a patient in an ED through Legacy or Unity in the last few months and you're still having difficulty, I don't bill and I'm not charged for. So I'm kind of built into program costs, I think.
That's great. I'm really excited to hear about all these accessible resources, and thank you for naming books, because I think we can also keep reading, keep nurturing ourselves through the media that we're choosing to consume or choosing not to consume. A couple of things I just wanted to chime in about is, so EOB, that was something that Mackenzie mentioned, is explanation of benefits. For folks who haven't heard that term, it's the letter that gets sent home by the insurance that essentially says, we saw you for XYZ thing. And some folks might not want that letter to go home if they're concerned about a parent, a partner, or someone else who might see that letter. So it's great to know that there are ways to access care without using insurance, without triggering an explanation of benefits. And then Summer mentioned an EAP program, the Employee Assistance Programs. You can definitely ask your employer if that's something you have access to. And I appreciate Summer's perspective about being able to be seen multiple times for different things each time, right? So take advantage of the resources that are available to you. We did have someone chime in on the Q&A saying that they have a kiddo who is missing triple point programming in a big way. So I do know that Triple Point is offering virtual meetups, and so folks can get in touch, but I also wanted to throw this back to Mackenzie.
Yeah, I was going to say the same thing. So Triple Point is offering virtual meetup stuff. And Wild Heart Society also is offering virtual meetup stuff. In fact, on Friday, most of the Wild Heart Society kids are having they're like doing cosplay prom where they all dress up and like get on Zoom and they're decking out their rooms and like hanging out and doing really fun stuff. And they do stuff like that every Friday. Sometimes it's heavy, like we talk about stuff that's going on in the news, and so that kids can have an understanding of why things are happening and why they're important and how they affect them. But also sometimes it's just like, we just need to cut loose. And they've made like projects together and they're planning things for when things all come back together. So that's one avenue, and we do that on Fridays. So in order to get connected to that, folks would need to email. You could go onto the Wild Heart Society website and fill out the Contact Us form. And then Emily is one of my interns, and she would reach out and sort of do an introduction and get to know you, and then give you the information on how to get into the group. And then on Wednesdays, we do one that's a little bit more about like emotional support for young people. And so that's another avenue that it's just not as like funsies. But it's more, this was heavy this week. So that's another thing that young people can get in on. And the age cap for that is, we've got people who are 18 in it right now. So we're less concerned about ages at this point, as long as people are getting along and know how to engage appropriately. I know that there's been concerns around ages when kids are in spaces together, but since everybody's engaging via Zoom, we get to bring people together more. So.
Thanks, Mackenzie. Do other folks have suggestions for virtual support, in particular for youth, but maybe for adults as well?
I think isn't the YWCA doing a Queerantine group too? I think that's what it's called. I think it's called Queerantine, and they're like, it's like once a month, and I could find the details and send that to you, Austin.
That'd be great.
Yeah.
The Native Wellness Institute on Facebook and Instagram, every day they do a power hour during lunch and sometimes in the evening too. And they address all sorts of topics like traditional medicine or mental health, or during Pride they did a whole bunch of topics on queer issues. But they just basically address community and support, and they call it a power hour. So is, as the name says, it's an hour-long worth of content, but they stream it on Facebook, and it's really cool. It's the Native Wellness Institute.
Brown Girl Rise is doing a holding space for Black and Brown youth, a safe space for BIPOC girls, young, trans, and non-binary femmes to engage in collective healing and radical self-care. It says ages 7 to 17. So it's Brown Girls Rise on Instagram. And I know that they were doing some other resources for Black and Brown youth. I know that the interns that are working at Therapeutic Change were trying to put together like a regular meetup, and to create space for people to talk, check in. We had kind of like a loosey-goosey idea of what some of the topics would be. We're gonna try to get that started again. We didn't have anybody enrolled before. So you can look on our website, and as soon as we get some information about that, it'll be available on there.
Fantastic. I just put that Brown Girls Rise and the Wild Heart Society in our chat in case you needed to see those spelled out. And we did get another Q&A. Someone said that they would like to access mental health services. They're currently living with a parent. While that parent is supportive, they don't want that person to worry if they start going to therapy. They aren't able to drive, so getting to an appointment by themselves might be challenging, but they just said that they think they might benefit from dealing with some of the stuff that's coming up for them. So I'm curious if y'all want to address that piece around maybe like other folks worrying if we access mental health services.
So I think probably what's going on is, again, that stigma of mental health just in general. If somebody said, you know what, I think I should go to the doctor and something's going on, most people wouldn't say, well, tell me all about it and what's going on and I should be so scared, right? I think people should understand that sometimes getting support for mental health is just a tune-up, like a check-in. It doesn't mean that somebody's face is going to melt off, right? It's not the worst case scenario. I think that it's important to, again, kind of frame mental health support as just kind of like, what's the best way to explain it? So the whole point of coming to a therapist is that it's ideally somebody who's going to be objective and supportive, and a cheerleader who's also going to like coach you and challenge you sometimes. And so why wouldn't we want somebody that we care about to get that kind of support and visibility and affirmation and care? And so if we frame mental health support in that way, it's kind of like, well, it's cool, another person on your team that cares about you, let's get you there, versus that it's the be all end all and I did something wrong as a parent, or I'm not supporting you in the right way and that's why you're not talking to me about these things. Sometimes you just need somebody else to talk to about stuff.
I second everything that Summer just said. Really. And I'll add, like, mental health stigma is real, and it's something that we have been working and fighting against for years and years and years, and we'll probably continue to fight against. And so I would encourage this person to look into one of the resources that we talked about that's free or low income. And then I think the other thing I would do is I would encourage this person also to try and talk with their parents about how going to counseling is actually the healthiest way to deal with your mental health, as opposed to trying to just muscle through, because we all know that works great.
I will third, and I will say that taking that first step and going to counseling is one of the bravest and courageous things you can do, and it's something to be proud and I think it's awesome that you want to do that.
Definitely. We got another Q&A. Someone wanted to let us know that they work at Lutheran Community Services Northwest as a crime victim advocate, which they are a non-systems-based advocate providing free support to victims of crime, which includes things like bullying, harassment, and hate crimes. They don't require a crime to be reported to police, and they serve all populations. So folks can access services online or by phone or by text, and they are saying that they do offer some longer term emotional support for folks as well, and that would include folks as family members. So that's another great reminder of there might be some resources out there that we might not think of as direct mental health care services, but that really do provide that appropriate wraparound care. Now, were you excited, or did you want to share something?
Totally just cheering for that.
Yeah, so thank you for sharing that in the Q&A. We really appreciate that reminder. And there are groups like the YWCA Clark County and lots of other community organizations that do offer social support and some free or low-cost mental health support services too. I'm always a big proponent of ask for everything you need, ask for everything you want. The worst answer you get is no or I don't know, and then you just keep asking other folks. And you'll find a lot of resources that way. So I'm curious what advice y'all might have for LGBTQ plus folks and folks who experience intersections of oppression around ways to support their own mental health, their own well-being, in particular like self-care practices that might be helpful in this time that we're in.
My advice is probably the same advice as I always have, is we're complicated plants, so water, food, get outside, get some sun. Also, get really good at saying no and listening to your gut when your gut's telling you no. We live in a society that really tries to deter us from having boundaries, especially if you are somebody who is perceived as female. We're kind of expected to do more than we need to. And so get really good at saying no. And maybe learn how to say, well, if you say no, most languages is pretty much no, but like different ways to say no. You know what, I appreciate that, but I'm unable to do so right now. Or, you know what, let me get back to you. I'll have to check my schedule. Or get out of my face. No, like practice all those ways of saying it.
I second that also. I feel like I could just hold up a sign and be like, what Summer said. Because those boundaries are so important and so uncomfortable that the practicing of them really does make a big difference. I also, I don't know how many times I've talked with people lately and they're feeling really down and more down than they normally do. And we start talking about what they're doing with their day, and they're not doing very much at all. So still get dressed, still take a shower, prepare yourself for the day, not just because you're going to be going someplace, but because you're worth preparing yourself for the day. And eat well and go outside. It's really helpful to get outside in a safe space where you can take a walk or just be among nature. I know that's not a luxury everybody has because nature isn't always super accessible, but it really does help if you can get outside. I would also encourage you to limit or choose wisely how much time you spend consuming news and social media, because that can be a really easy hole to get sucked into, and you find yourself reading every single article. I have done it, and all I do is feel terrible and bad afterwards, and I don't know anything new. So I think that's the sort of the educate yourself and then go do something fun that fills you with joy. Self-care isn't just about like, I like bubble baths. Self-care is about what fills your cup, and what fills your cup is different for every single person. And so really getting curious and figuring out what fills your cup is really the best way to take care of yourself.
I want to add the community and connection piece, because when we're all quarantined, it's really easy to become isolated and only interact with the people that we're living with. And we get sick of those people real quick. So, you know, reach out to your community, reach out to your friends, reach out to people you're not at home with. Community, that's what it's there for you to touch with and say, you know, hey, I'm struggling with this, or hey, this was really cool that happened today. Can we all celebrate together? But that connection piece is another thing that can fill that cup up, in addition to, of course, water, food, sun, nature.
Sorry, go ahead, Maddie.
I think one thing I would really like to add is lower your standards for what you need to do. Like, I feel like everybody in the LGBTQ community that I've ever talked to has a voice in their head that is always listing like all the ways that we fail, all our flaws. And I know for me, like that voice didn't shut up for a couple of decades. And I want to say that it is okay to turn that off. It is okay if you didn't do your dishes. It is okay if you showered yesterday and you didn't get to it today. Like, self-compassion for small failures is really important, and trying to make that a part of a daily practice is something that I definitely can say from personal experience did a lot to save my own mental health.
So the other thing that I find is helpful is I like to read. And so I download books from the library on my phone, and they offer audiobooks, books you can like download and read. It's all free. I think there's even, if you have Overdrive, you can download movies and stuff and watch those for free. The other thing I would say is if you have the means, snail mail is awesome. You send mail to people, you make them send you stuff too, and there's like a little present in your mailbox when you go to check, instead of just crappy adulting bills. So those kinds of things. I know that I'm in a BIPOC queer group and somebody has Jackbox. And so every once in a while they'll schedule a Jackbox and we'll all log into our Zoom and play Jackbox. People I don't even know, but it's kind of fun. If there's a way for you to tap into something that's creative for yourself, whether it's drawing, like some sort of visual art, whether you like to make stuff, get some glue, cut stuff up, do it. If you like to cook, if you like to try new recipes, do that for yourself. And if you just need to cuddle with your fur babies, do that. Sometimes if you need to just not answer your phone, that's okay too. I feel like at the beginning of this quarantine, people were really making a lot of effort to be connected all the time because it was like, there's nothing else to do, we got to be connected. And I don't know about y'all, but I got kind of burnt out from it. Like, it's okay to take space for yourself. It's okay to, again, to say no. And it's okay to kind of explore what it is you need to take care of yourself, because so many of us have just been running this entire time. And I don't mean that in an ableist way. I mean that in like a mentally, emotionally, spiritually, like just in motion for such a long time, trying to like make ends meet. And in that, we don't get an opportunity to actually get to know ourselves and figure out what we need. And so take the space to try some stuff on and see if it fits. And if it doesn't fit, put it away.
Thanks, y'all. That is just such great advice for all of us. And our conversation is coming to an end for now, but the conversation can definitely continue if you want to connect with us on our Facebook page. I also wanted to shout out a couple other things that we didn't talk about today. One is Teen Talk, which is a support line for youth ages 13 to 17. It is for teens by teens, and currently they are sending out free self-care packages to teens in Clark County. If you want more info about that, that is going to be posted up on our Rainbow Support Clark County Facebook page too. As well, NAMI, the National Association for Mental Illness, is interested in starting a peer support group for LGBTQ plus folks who experience mental illness. So they are seeking some folks, one who'd like to participate, but also some folks who might be willing to facilitate and help lead a group, a peer support group. So if you are interested, you can connect with them. They are NAMI of Southwest Washington, and their info is going to be on Rainbow Support Group as well. And I think that Jessica maybe just put that into the chat. There's the info for y'all. There's a phone number for Teen Talk at the bottom. So if somebody wants to connect about those resources or just connect to talk, that is there. So we'd also like to open up the Q&A now if you want to send us an email address where you'd like us to email you things. I know not everyone is a Facebook person. I am not. We will email you some PDFs with some info. So go ahead and drop that into the Q&A if you'd like, and we will email you that there. And that will be, again, something that folks won't be able to see when you post your email up. It'll be private. I want to say a huge thank you to our panelists for sharing your wisdom and for really helping spread some knowledge and some joy around how we can get access to mental health services and how we can take care of ourselves. So thank you very much. We have had a really rich conversation, and I know folks might be eager to continue. If you'd like to, we are going to stay on for another 30 minutes after we end this recording for folks to come off mute to show us their video if they'd like, and just share what's coming up for them and talk some more. So again, thank you so much to our panelists, and we will take actually maybe a 3-minute break, a little bio break for folks, and then we'll be here until 7:30. Oh, and one last thing before I forget. Nope, that's not what I wanted. Oh, there it is. Jessica put it in. It is a Google form. If you want to give us some feedback for today, how to make an event better in the future, what you liked, the next, I think, panel discussion we'll be having will be about healthcare and about sexual and reproductive healthcare as well, because those are both things that folks were really interested in talking about. So if you have thoughts about that, you can give us more feedback at that Google form, connect with us via email, or come find us on Facebook. All right, thank you, Maddie, Summer, Mackenzie, Megan. You have all been amazing.
Thanks for having us. Jen, thanks for doing this.
It was really fun.
Thanks, y'all. Take care.
Thanks for having us.
Bye.
So folks, we're gonna take about 2 more minutes, 2-3 minutes, and let folks have that little bio break. When we come back, we'll open up the space if folks wanna chat, want to share, want to participate in whatever way they want to.